Hidden deep within your abdomen lies a 6-inch organ working non-stop to sustain your life. Yet most people barely give it a thought until something goes seriously wrong. The pancreas is responsible for producing the enzymes that break down every bite of food you consume and the insulin that regulates your blood sugar. When it stops functioning as it should, the body essentially begins to starve from within. Here's the part many overlook: pancreatic failure rarely shows up with loud, dramatic warnings. Instead, it speaks softly through subtle signs that nearly 90% of people brush off as ordinary digestive troubles, stress, or simply the effects of aging. By the time the more obvious symptoms emerge, serious and often irreversible damage is usually already underway. If this is your first time here, welcome to a channel devoted to raising true health awareness. Our mission is to share evidence-based insights that have the power to save lives. Be sure to subscribe and turn on notifications so you'll never miss our latest updates, and let us know in the comments where in the world you're watching from. We love hearing from our global community. In today's video, we'll uncover 11 scientifically documented early warning signs of pancreatic failure. These clues, supported by peer-reviewed research, can surface months or even years before the disease becomes life-threatening. Recognizing them early could mean the difference between timely intervention and irreversible harm. 1. Jaundice. The first and perhaps most concerning warning sign is jaundice, marked by a yellow discoloration of the skin and the whites of the eyes caused by a buildup of bilirubin in the blood. When jaundice develops in the setting of pancreatic disease, it usually signals that inflammation, scarring, or even a mass in the pancreas is obstructing the bile duct. This form of jaundice results from a physical blockage of the common bile duct, which runs through or directly alongside the pancreatic head before emptying into the small intestine. Swelling from acute inflammation or fibrotic scarring from chronic pancreatitis can compress or even completely obstruct this duct. The earliest clues often appear in bodily fluids. Patients may notice their urine turning darker, tea-colored or amber, as excess bilirubin is excreted through the kidneys. At the same time, stools may become unusually pale or clay-like due to the absence of bile pigments reaching the intestines. The yellow tint typically shows up first in the eyes, where it is easiest to spot. Often, friends or family members notice these subtle changes before the individual does. As bilirubin levels climb, the yellowing extends to the skin, most often beginning with the face. Many patients also develop severe itching, or pruritus, as bile salts accumulate in the skin, creating an almost unbearable urge to scratch. Abdominal discomfort frequently accompanies pancreatic-related jaundice, usually centered in the upper abdomen and radiating toward the back. 2. Early diabetes symptoms. The second red flag arises with the onset of diabetes-like symptoms as the pancreas loses its ability to produce insulin. Damage to the insulin-secreting beta cells often occurs alongside deterioration of the enzyme-producing acinar cells, resulting in a form of diabetes known as type 3C, or pancreatogenic diabetes. This condition is distinct from both type 1 and type 2 diabetes. Research indicates that as many as 80% of people with chronic pancreatitis eventually develop diabetes, with risk increasing in proportion to the degree of pancreatic damage. The early signs resemble those of other forms of diabetes but occur in the setting of ongoing digestive disturbances. One of the first changes many patients notice is frequent urination, often waking multiple times during the night. This happens when rising blood sugar levels overwhelm the kidney's ability to reabsorb glucose, allowing sugar to spill into the urine. As a result, excessive thirst develops, driven by fluid loss. Patients often describe an unquenchable need for drinks, especially cold beverages, and consume far more fluids than they once did. Another hallmark is relentless hunger despite steady weight loss. Because the body's cells cannot efficiently use glucose without adequate insulin, they remain starved of energy even in the presence of high blood sugar. This paradox leaves individuals both constantly hungry and progressively thinner, reflecting the underlying metabolic failure. 3. Fatigue and weakness. Profound fatigue and steadily worsening weakness, far beyond ordinary tiredness. This draining symptom arises as long-term malnutrition undermines the body's ability to generate energy at the cellular level. When digestive enzymes fail to break down proteins properly, amino acid levels fall, disrupting muscle repair and protein synthesis. At the same time, poor carbohydrate digestion limits glucose availability, depriving the body of one of its most immediate energy sources. Patients often describe waking up already exhausted, as though sleep has provided no restoration. Daily routines become increasingly burdensome, climbing stairs, carrying groceries, or even maintaining normal productivity begins to feel overwhelming. On a metabolic level, the problem stems from several deficiencies acting together. Protein malabsorption leads to muscle wasting, vitamin shortages interfere with energy metabolism, and poor iron absorption may contribute to anemia. Clinical research notes that many individuals experience sudden energy crashes after meals, especially those high in fat. Instead of being replenished by food, their weakened digestive system diverts precious energy toward processing it, leaving them more depleted than before. 4. Vitamin deficiencies. The fourth red flag appears in the form of deficiencies in fat-soluble vitamins A, D, E, and K, which often reveal themselves through symptoms that seem unrelated and are easily mistaken for aging or stress. The underlying cause lies in fat malabsorption, which blocks the body from properly taking in these critical nutrients. Unlike water-soluble vitamins, which can still be absorbed even with partial digestive impairment, fat-soluble vitamins depend on well-digested fats to form micelles that allow absorption in the intestines. When this process fails, deficiencies begin to show, each carrying its own unique consequences. Vitamin A deficiency is often the first to emerge. It may present as subtle vision difficulties, such as struggling to adjust to dim light or experiencing night blindness. As the shortage worsens, the skin can become dry and rough, while the immune system grows weaker, leaving the body more vulnerable to infections. Vitamin D deficiency manifests through musculoskeletal symptoms frequently dismissed as normal aging. Patients may feel persistent bone or joint pain, muscle weakness, or notice they fracture more easily. Because vitamin D is essential for calcium absorption, long-term deficiency can drive the development of osteoporosis. When vitamin E is lacking, neurological changes often surface. People may experience muscle weakness, poor coordination, or peripheral neuropathy, with signs like frequent cramps, balance problems, or tingling sensations in the hands and feet. Vitamin K deficiency primarily disrupts blood clotting. This can appear as easy bruising, prolonged bleeding even from small cuts, or unexpected nosebleeds. Each of these signals reflects the body's inability to utilize fats properly, making them critical warnings that should never be ignored. 5. Nausea and vomiting. Persistent nausea and recurring vomiting, most often linked to meals, especially those higher in fat. This troubling pattern emerges as the digestive system gradually loses its ability to process food efficiently. When the pancreas cannot produce enough enzymes to break down fats, undigested lipids build up in the small intestine. This triggers the release of hormones such as cholecystokinin and secretin. While these hormones normally support digestion, In excess, they can provoke overwhelming nausea. Symptoms usually appear within 30 minutes to 2 hours after eating, the very window when pancreatic enzymes should be active. What often begins as a mild queasy sensation can intensify into severe nausea, sometimes ending in vomiting. Interestingly, vomiting may bring brief relief but rarely resolves the underlying issue. These episodes carry certain hallmarks. The vomit often contains visible pieces of undigested food, evidence of impaired digestion, and tends to have a sour or rancid odor from partially broken down fats. Unlike infections, however, this type of vomiting usually occurs without fever. Over time, many patients begin to dread eating. Even the thought or smell of food, particularly rich or fatty dishes, can trigger anticipatory nausea. This psychological overlay worsens the physical distress, causing individuals to avoid meals altogether, which further fuels malnutrition and deepens the cycle of digestive decline. 6. Loss of appetite. Gradual decline in appetite that goes far beyond the occasional disinterest in food. This change arises from a mix of ongoing discomfort, impaired digestion, and the body's reaction to chronic undernourishment. For many, meals become linked with unpleasant experiences. Abdominal pain, especially after eating fatty foods, combined with bloating, gas, and digestive distress, turns eating into something to be avoided rather than enjoyed. Because nutrients are not properly digested or absorbed, the body's usual hormonal signals that regulate hunger and satiety become disrupted. Patients often feel full after only a few bites, not because their stomach is truly full, but because their digestive system struggles to cope even with small amounts of food. Research shows that people frequently describe a profound shift in their relationship with food. Meals they once looked forward to may now seem unappealing, and in some cases, they forget to eat altogether as natural hunger cues diminish. Food-related anxiety can also develop, as patients worry about which dishes might trigger their symptoms. Unlike appetite loss caused by medications or mood disorders, this type is closely tied to digestive difficulties and usually worsens over time. Reduced intake then accelerates malnutrition, which in turn places greater strain on pancreatic function, creating a harmful cycle that can be difficult to break. 8. Bloating and excessive gas. Ongoing bloating and abnormal gas production, far beyond the mild discomfort most people occasionally feel. This develops when partially digested food lingers in the intestines, providing fuel for bacterial fermentation that generates large amounts of gas. Without enough pancreatic enzymes to fully process proteins, fats, and carbohydrates, these nutrients pass into the colon nearly intact. The gut bacteria then feed on this surplus, producing hydrogen, methane, and other gases in abundance. Proteins that remain undigested undergo putrefaction, releasing hydrogen sulfide and sulfur compounds that give the gas an especially unpleasant odor. Meanwhile, unabsorbed carbohydrates ferment, further amplifying gas output. Patients often describe a sensation of their abdomen swelling as the day goes on, with discomfort peaking after meals. The bloating is sometimes visible, leaving clothes uncomfortably tight and disrupting daily activities. Flatulence may be frequent, voluminous, and notably offensive in odor due to sulfur byproducts from protein breakdown. Beyond physical discomfort, the social impact can be profound. Many individuals withdraw from shared meals, public gatherings, or even close personal interactions out of fear or embarrassment. This persistent bloating and gas not only affect digestion but also erode confidence and quality of life. 9. Chronic diarrhea. Chronic diarrhea, a condition that stands apart from the occasional stomach upset most people experience. Unlike short-lived bouts that clear up in a few days, this form lingers, presenting as frequent, loose stools that persist for weeks or even months. When the pancreas fails to produce enough digestive enzymes, food remains only partially broken down as it moves through the small intestine. This undigested material draws water into the gut, creating an osmotic effect that triggers ongoing diarrhea. Individuals may face 3 to 8 episodes a day, often accompanied by an urgent need to use the restroom that disrupts daily routines and social interactions. The stools are generally bulky, pale, and alternate between watery and loose. Unlike infectious diarrhea, there is rarely blood, mucus, fever, or severe cramping. Symptoms tend to worsen after meals, especially when fatty foods are involved. Because the struggling pancreas cannot deliver the enzymes required for proper digestion, many people start avoiding certain foods or limiting portion sizes in hopes of relief. Unfortunately, this often worsens weight loss and nutritional deficiencies. Over time, the constant loss of fluids and electrolytes can result in dehydration, weakness, and mineral imbalances. Beyond the physical toll, the frequent bathroom trips interfere with sleep, work, and social life, steadily eroding quality of living. 10. Fatty, oily stools, steatorrhea. The form of unsettling changes in bowel movements, something many people feel too uncomfortable to mention to their doctors. Medically, this condition is called steatorrhea, and it develops when fats pass through the digestive system largely undigested, because the pancreas is no longer producing enough lipase. Under normal circumstances, stool should sink in the toilet and maintain a healthy brown color. But when pancreatic enzyme production drops below critical thresholds, dietary fats cannot be properly broken down or absorbed. As a result, stools take on very abnormal features. With steatorrhea, bowel movements are often pale or clay-colored rather than brown. They look greasy or oily, may float instead of sinking, and often leave behind a stubborn, sticky residue or oily sheen in the toilet bowl. The smell is equally telling, described as unusually foul, rancid, or sometimes with a sweet-sour quality that is hard to miss. Scientific studies highlight the difference clearly. A healthy digestive system absorbs about 95% of dietary fats, while someone with pancreatic insufficiency may absorb less than half. This sharp decline is what produces the distinct appearance and odor that makes steatorrhea such a strong diagnostic sign. Importantly, these stool changes can appear fairly early in the disease and then become progressively worse. Patients often notice that the symptoms intensify after high-fat meals, such as fried foods, dairy, or nuts, making it an especially critical clue that the pancreas is struggling. 11. Unexplained weight loss. The 11th and perhaps most concerning warning sign is sudden, unintentional weight loss that cannot be explained by diet or lifestyle changes. In medical terms, this means shedding more than 5% of body weight within 6 months without deliberately cutting calories. For those developing pancreatic insufficiency, this weight loss often accelerates as the condition worsens. The reason is simple yet devastating: when the pancreas fails to produce enough digestive enzymes, particularly lipase to break down fats and protease to process proteins, the body loses its ability to absorb nutrients from food. A person may eat regular meals, or even increase their intake to satisfy constant hunger, yet still starve at the cellular level. Clinical reports from leading medical institutions describe patients dropping 20 to 40 pounds over just a few months while eating the same or more than usual. The paradox stems from undigested food moving through the intestines without being absorbed, causing malnutrition despite adequate calorie consumption. In response, the body begins breaking down its own fat reserves and muscle tissue for energy. Because this process is gradual, it often goes unnoticed at first. Loved ones may not immediately recognize the change, and many patients dismiss it as stress-related or the result of extra activity. By the time the weight loss becomes unmistakable, pancreatic function may already have fallen to less than 10% of normal enzyme production. The consequences reach far beyond the number on the scale. Persistent fatigue, a weakened immune system, and delayed wound healing are all common as protein-energy malnutrition takes hold. 12. Persistent abdominal pain. One of the earliest red flags is a deep, unrelenting ache in the upper abdomen that feels noticeably different from ordinary stomach upset. This is not the sharp grip of cramps or the burning sensation of acid reflux. Instead, it's a steady, gnawing discomfort that frequently radiates through to the back, creating a band-like pressure across the midsection. Gastroenterology research explains this distinct pain pattern by the pancreas's location in the retroperitoneal space, lying close to key nerve pathways. When the pancreatic tissue becomes inflamed or injured, those nerves carry pain signals along specific routes, which is why the discomfort seems to pass straight from the front to the back. The timing of the pain is equally telling. Unlike many digestive aches that rise and fall with meals, pancreatic pain is more constant and often intensifies after eating, especially when fatty foods are involved. This happens because the damaged pancreas struggles to release the enzymes necessary for breaking down fat, leading to further inflammation and pressure inside the organ. Clinical observations reveal that people frequently mistake this discomfort for muscle strain, stress tension, or even kidney issues because of where it spreads. Many resort to over-the-counter medications, which usually bring little relief. Unfortunately, by the time the pain becomes intense enough to seek medical care, the pancreas may already be significantly impaired. Doctors stress that persistent upper abdominal pain lasting several days, particularly if it radiates to the back and worsens after meals, should never be ignored. Immediate medical evaluation is essential. These 11 warning signals are your body's urgent way of telling you that something is gravely wrong with one of its most essential organs. Scientific evidence makes it clear that recognizing the signs early and taking action can profoundly change the trajectory of pancreatic disease. When identified in its initial stages, treatments such as pancreatic enzyme replacement therapy, combined with targeted dietary changes, can often slow down, or even stop, further damage. The heartbreaking reality is that many people overlook these clues until it is too late. They brush off persistent pain as stress, blame weight loss on getting older, and feel too embarrassed to bring up stool changes with their doctors. If you've noticed several of the symptoms we covered today, don't wait for things to get worse. Make an appointment with your healthcare provider right away and mention your concerns about pancreatic health. With timely blood work, imaging, and specialized pancreatic function testing, you can get clear answers before irreversible damage occurs. If this video gave you valuable insight into the early signs of pancreatic failure, please write helpful in the comments. It truly encourages us to keep creating evidence-based health content that may save lives. Be sure to like this video so others can find this vital information, and share it with friends and family who could benefit. Finally, subscribe to our channel for more medically accurate health education. Thank you for dedicating time to learn about these warning signs. Your health is precious, and knowledge remains your strongest defense.